Carol.
Hi.
Okay, so it looks like we're doing some shockwave on your left knee. Is that correct?
Hey, that's right.
All right, so I'm thinking you just pointed at the left knee. I think if we did you face down, that might be a good way to go. So go ahead and lay face down. I commonly mark the area of this diamond pen, so I'm gonna ask her if it's okay if I just kind of pull up your pants for you.
That's fine.
Okay, got it. Now, what do you have going on your knee?
It just aches, goes out on me.
Have you ever had an X-ray? Do you have bone on bone, or do you still have a meniscus in there and cartilage?
There's been an X-ray, but it's been some years back.
Did they still say there's space in there in the joint, or is it
Close to.
bone on bone? Okay. And did you ever have a meniscal tear that you know of?
No, I don't know.
Okay, got it. All right. So I'm just gonna take my pen and mark where I would have my staff working. All right, so I got her all marked, and if someone else was to come in, they'd know right where to do everything. I'm gonna roll the Shockwave over here. I'm gonna get BioFreeze. Now, if it was on their face, which Shockwave shouldn't be on the face anyway, but you wouldn't want it in any open wounds. BioFreeze would really hurt. We do have gel that is not as spicy as I would call it, almost as BioFreeze. BioFreeze is definitely gets cold and then hot and all that. But it feels pretty good, all right? So now we're gonna take the gun, get ready to go, and start the Shockwave treatment. I'm gonna come over here and look. I guess I could leave the Shockwave part there. If we looked here and we were trying to find knees, I'm gonna go over here and I'm gonna find the little man, and I see one call for the knee. So I'm gonna push OK on that. I'm gonna push start. You're gonna hear a little bit of a noise. And then now it's ready. So you don't want to ever dry fire this, okay, you guys? So you want to have it on the tissue, then you're going to push the button. So again, the button right here, see that how it says play? Play or pause. And what I like to do is I like to just kind of grab this around like that. And then I just like to work the tissue. I might even go a little bit, grab some of this stuff and kind of go a little bit along the calf here. Never, never, never go in the popliteal fossa. Same with the elbow. You never go in the crease of the elbow or the knee. There's veins and arteries in there. Brett and I were discussing how it's a dangerous zone, so just stay out of there. But you can certainly go alongside it. There's a lot of attachments along here. If you think of the quads and the hamstrings, they go across here and they attach in. Now I'm going to probably, Carol, get some goop on your pants. Normally I'd put a cloth right there, you guys, but her pants are just kind of, they're not super slim, but they were kind of hard to pull up anyway. Sorry about that. She says that's okay. Try not to get goop on their clothes if you can. Cut. If you want to come around, I'd like to show you kind of where I'm going and the amount of pressure I'm doing. I'm actually putting quite a bit of pressure into the joint. Carol says, yeah, probably more than they do sometimes, but really going along the knee joint here. Not on the bone, but real close to it. Carol, how's that feeling? It's a little sore, so I can, does it feel better if I lighten up? Does that feel better?
Yeah.
Okay.
But I mean, it's terrible. Whatever you need to do.
Okay, like in other words, she's tolerating it. I push a little harder than most because I'm the doctor and I'm just not afraid of getting in there and enjoying it. All right, so that is completing the treatment. Next step is you always wipe your own tools first. Get that head all cleaned off. Again, this needs regular weekly maintenance. Every 100,000 shocks goes back there. The stop button's right there. Sometimes the programs are a little long because they're not exactly precise because I loaded only so many in there. Okay, but you can stop it at any time. If the patient says they're uncomfortable, you stop it and come get the doctor and then tell me what's going on. Don't let the patient get up because I might be able to get around it and help them. Most of the time, I don't think I hear anybody complain. So I see that she's all done now. I'm gonna pull this out and put this right under here. That's where that goes. And now Carol's gonna go ahead and sit up, Carol. Take your time, and then we're gonna head to knee decompression because we're doing the knee protocol, which includes sometimes Neuromed, definitely always Shockwave, at least once a week, and then knee decompression and hot laser. So we're gonna go do the hot laser and then the knee decompression at the same time. All right. Okay, Carol, so it looks like we're back to that left knee. That's the right. Okay, that's one thing. You gotta do surgery on the right part. Just kidding. We're gonna have her slip off her shoes. Almost everything in this room is no shoes, no belts, no keys, no stuff in your pockets type of thing. Now this one, she doesn't actually need her jeans way up like Shockwave. So we're gonna kind of get her situated. Now she has a back brace there. Is that comfortable, Carol?
Yeah.
All right, good. We're gonna feel for the knee, and then we're gonna go a couple fingers down. We were doing this earlier, Brett, do you remember? So Brett has probably seen this for probably 20 minutes himself or less. All right, so got that. This stuff makes everything not move. So my parents, I always laugh, go ahead and lift up your knee. In their motor home, when they're going down the road, they can have literally vases of flowers on a table. They have this stuff underneath it, and the stuff doesn't fall over. So if you've ever traveling down the road in a motorhome, that's the good stuff to have. It was weird. I was just like, that's amazing. Stuff with water in it. Okay, so it does a similar thing. It's gonna grip it and make sure it doesn't slide, especially if she has like clothes that are slippery, because some patients have slippery clothes, like those sporty pants that are kind of shiny and your hands can just fall right off them. All right, so we got her here. We're about 2, 3, 4 fingers down. I really feel like I need to come up a little bit because I really want it to be about 2 fingers down from the knee. But again, it's all according to, and you just like straighten your leg out. There you go. That would be good. Thank you, Carol. And then we're right there. Okay, so we're just gonna get it on tight. We don't wanna have it so tight she's gonna die. This is just like a blood pressure cuff. You get in there, get your fingers in there, and you can feel how tight it is. Now this is really tight, agreed? Go ahead, Brett, feel in there how really tight that is. If the patient didn't say anything, that's cutting off circulation. That's like blood flow restriction. But I think she could, after I go that hard, I think she could handle what I got now. Right?
better.
She's gonna almost feel better just because I let some pressure off, haha. So do that so that it's tighter than loose, because if it falls down, you gotta start all over. The next thing is this little thing. It kind of fits. You want it to be about 4 fingers from the foot because it's gonna pull the whole leg down. So that looks really good, like a good setup. We're gonna come over here now, and you're gonna see the dial here, and it says ready to start. Well, I'm not really ready until I see 900 seconds, so I'm gonna go back to 900, okay, and that means 15 minutes. Then I'm still gonna turn that. I'm 18 pounds. Well, that would be for a 180-pound person, 150, 180. May I ask your weight, ma'am?
160.
160. So she could probably do more like, oops, there it goes. It just has a mind of its own. I'm gonna cancel the session, yes, because they're, okay, you guys see how it's already gonna start knee decompression. Okay, we gotta wait for the beat, and that's gonna happen. We're gonna turn this, and I'm gonna take it down to 17, or look at the card, because the doctor already said 17 pounds, 900 seconds, and setting number 3. Okay, so I've already prescribed her. Now we're gonna move again, 900, 17, and is it setting number 3? By golly, it is. So we're good to go. We're gonna now push start, and then just make sure it doesn't slide off her, like down her legs. So it looks like, see, it's already gonna start tractioning. You'll see how, we want the foot to be comfortable, so you wanna have some room for that. Are you feeling that pull? Mm-hmm. Yeah. So again, this, just like spinal decompression, it's gonna kind of pull and release back and pull and release back, but it's tractioning, open the joint. So if it's bone on bone, man, that feels really good to have it kind of tractioned in there. It's great for knees. I have a lot of patients. Oh, and I forgot the most important part, and there I am, and she was sliding down the table. So I'm gonna go ahead and fix it myself where we get the whole piece in there. So I'm gonna cancel the session, and thank you, Carol, for being patient with me. I'm gonna go back and reset it all up with this middle piece on her leg so she doesn't get pulled down the table, because it does pull pretty hard. And she'll get a better treatment doing it exactly the right way. So we're gonna strap her in on the same leg, and then we're going back here and we're gonna go to the dial, 900, 17, 3, and start. And now she'll have a much better experience because it will traction open the joint better. All right, you guys, and that's something to learn. Just slow down. If you make a mistake, go back up, start again, correct it, and then leave the patient with a timer over here for 15 minutes. And just say, you know, Carol, you look like it's doing good. How does that feel?
It feels fun.
Okay, good. And so we'll see you in about 15 minutes.